Good day, Dr. Radhika. Very happy Plastic Surgery Day to you. I have a few doubts about plastic surgery. I hope you will be able to clear that today. What is plastic surgery? Do you actually use plastics?
So no, in plastic surgery, basically plastics are not used. Plastic surgery, the name plastic has come from the word, which is a Greek word, plastikos. It means the ability of the tissue to be molded.
I heard that plastic surgery has its origin from India. Is it true?
Yes, that's a legacy. It's true. The origin of plastic surgery was in India, and it first came into use in around 800 BC by Sushruta, and he basically used a cheek flap to reconstruct the nose.
Oh, that's a very long history. What does plastic surgeons actually do?
There are many things a plastic surgeon can do. It's a vast field. Okay, so broadly we can classify it into two types. One is reconstructive surgery and the other is aesthetic surgery. Now in reconstructive surgery, there are multiple other subunits. One of them is Onco reconstruction, wherein reconstruction is done in cancer patients. Second is trauma after accidents. Whatever reconstruction is done is also a domain of plastic surgeon. Then one is hand surgery. Then also in patients with burns, plastic surgeons have a very crucial role to play. And even these days in gender affirmation surgeries, the role of plastic surgery is huge. And in aesthetic surgery, obviously you all know about body contouring procedures, tummy tuck procedures, liposuctions, and also there is a non-surgical aspect to plastic surgery in field of aesthetic surgery, which includes the use of Botox, the use of fillers, and so on. PRP, hair restoration, and all that is also included in the domain of plastic surgery.
Oh, I did not know that. Can you please shed some light on reconstructive surgeries?
Okay, so like I said, that reconstructive surgeries basically help the patients in getting back their form and function. It can be either after tumor removal or after trauma. Most commonly, the reconstructive procedures are done for cancer patients and also for the trauma patients.
That's very interesting. So my friend is undergoing a jaw tumor surgery. Can you please tell me about the reconstruction options?
Okay, so there are multiple options available in jaw reconstruction surgeries. And the principle of plastic surgery is that we replace like with like. So if the conditions are ideal and everything is in a streamlined way, then we can take a bone from your leg, from the outer aspect, and we can use it to reconstruct the jaw. So the cancer surgeon is going to remove the bone and we are replacing it with a bone itself. That's why it is called as replacing like with like.
I was recently looking on Google. I stumbled upon this 3D printing in plastic surgery. Can you please tell me more about it?
Sure. So the role of 3D printing is basically in jaw reconstructions, because in jaw reconstructions, it is all about occlusion. By occlusion, I mean that normally our jaw, the upper jaw, it rests on the lower jaw. So for that only, the surgical procedure should be very precise so that we don't lose that kind of configuration which we normally have. So in that, basically a CT scan is taken, and with the help of many softwares, a 3D model is printed. The cuts are pre-decided both at the head end and also at the leg end, and the precision of the surgery increases, and a mock surgery basically can be done in the lab itself before doing it actually on the patient. So this helps in reducing the surgical time, first of all. Secondly, the contour and the shape of the face becomes near normal, and also the occlusion is perfect. So that is the role of 3D reconstruction in plastic surgery.
This is actually the technology touching the humans. Very interesting. So I have one more question. My aunt is undergoing breast cancer surgery. She wants to know about further reconstruction options. Could you please highlight those?
Yes. So in head and neck surgeries, especially malignancies, that is cancer, plastic surgery is more of a compulsion than a choice. But in breast reconstruction, it is a choice. There are multiple options available which a female can choose that how she wants to get her breast reconstructed. Okay, we can take the extra fat which is present in the lower part of your tummy. We can take tissue from your back. We can take tissue from your buttock. We can take tissue from your thigh. And it also depends on generally the body habitus of the patient. Like where we'll get more amount of tissue, generally we prefer taking the tissue from there. So there are multiple options. Also, prosthetic options are available, which include the silicone implants. But generally, autologous reconstruction, by autologous reconstruction, I mean that using your own body tissue to reconstruct is generally preferred, because these are tumor patients and they further undergo radiation and chemotherapy. So autologous breast reconstruction is superior to implant-based reconstructions.
That's very interesting. Recently, we came across a young kid with a tumor in his face over the cheek. We're just wondering, can he ever have teeth to eat? How will he ever be able to eat?
So one of the domains of plastic surgery is pediatric reconstructive surgery. In pediatric reconstructive surgeries also we take tissues from other parts of the body, the child's body itself, and it can be used to reconstruct the jaw. But yes, it also depends on the age of the child. Okay, initially we can start off with something very simple, but later when the child has attained the age, then we can offer them bony reconstruction along with implants, so that the patient is able to chew later and lead a normal life.
So what will happen to the part where you have taken the flap from?
Okay, that's a very good question. So the part from where we are going to take the tissue is called as the donor site, because that area is donating. So donor sites are usually expendable, as in, like, even if we take them out, it does not cause any functional morbidity. And the surgeries itself are designed in such a way that the nerves, the blood vessels, the underlying muscles, whatever are there, which are crucial and are vital, are left behind, so that we are not creating an additional problem to the patient.
That's very interesting. How does a plastic surgeon improve a person's life?
Plastic surgeon comes into play when the cancer is out of the body. So basically the role of a plastic surgeon in this multidisciplinary domain is to show something which is beyond cancer. Okay, so first of all, we have to look at the functional rehabilitation of patient. Like I mentioned, in head and neck cancer surgeries, it is more of a compulsion than a choice. In head and neck cancers, whenever patients, they lose jaw or they lose their tongue, it is the role of the plastic surgeon to reconstruct, so that after their completion of the treatment, they are able to speak properly, they are able to swallow, they are able to eat properly, and they are able to sustain a life which is independent, again how like they were before surgery. And basically many patients come and ask us about scars also. See, there will be no surgery without a scar. That is how we start, but we can do certain things which will make your scar better. Okay, it will be more acceptable to the human eye. So that, and especially like if you give a morbid scar to a patient, then their social rehabilitation, going back into the society, it affects them psychologically, socially. They lose confidence, they are not able to interact with people. So that is when plastic surgery comes into place. Basically it helps in functional, social and also psychological rehabilitation of the patient, so that they are able to live a normal life after having such huge extensive surgeries.
Thank you, madam. You are truly changing every patient's life and face with one flap at a time.
Thank you.